alcohol is really the key barrier to development. It's a barrier to employment. It really holds people back in poverty. The small little bags of alcohol that are being sold really, really cheap so that pretty much anyone can afford them. And so because of that, I'm trying to link my research looking at alcohol and violence, alcohol and HIV, so that we think of alcohol and drugs really as one of the huge risk factors for a lot of these health problems, that if we dealt with the alcohol problem, a lot of the other problems would go away.
Okay, it's okay.
Let me have the show. Thank you so much. I appreciate it.
We've had some good relationship with Georgia State University, and we've written a number of papers with some of the staff, and most especially Professor Monica Swan. This has been quite helpful because together we are working on an alcohol and drugs research center.
It's really just exciting to be here at Makerere University in the School of Public Health. I work here with Professor Nazarius, and our biggest project that we're working on is really setting up this alcohol and drug use prevention research center. I'm very excited that the research that I've been doing is really providing the information and the justification for why this center is so important.
Uganda is one of the places which is quite well known for high levels of alcohol consumption. It's among the top 2 countries in Africa with high per capita alcohol consumption.
We are here for a meeting in Butabika Hospital where we are discussing the formation of a surveillance system for drug abuse, and I'm glad that we have Monica Schwan, the Fulbright scholar, to help us in this, and we are just so grateful for this, and we are very ready to work with her, and we look forward to her support. She's really supported us in so many other things, and we hope that she will put this in order for us as well.
Why am I in Uganda and doing this? And I think it's evident that the problems are really huge here. The alcohol and drug use problems have not been addressed. There's not a lot of research for it. So we're hoping that this new center will really help to fill that gap and influence policy in a way that can really help people to overcome poverty and strengthen employment and the other barriers that the country is facing.
We appreciate the work you are doing in this country, especially in the area of research in alcohol drug abuse. This is an area where we've not been doing very well in this country, and yet we know that data, first and foremost, is very important for us as a country. We need to use it for guiding policy direction. You can't, for example, persuade people to support a treatment facility with funding if you don't have the data to back up the evidence that you are giving.
Professor Monica is a very interesting person because we met in Denmark 8 years ago, and we told her there's a big need. We are coming in a country which has had a big challenge with HIV/AIDS, where HIV/AIDS has been devastating communities and affecting young people. But we told her that much as we are doing HIV/AIDS, nobody was looking at alcohol. Very interesting area because we have never sat down to do a full assessment of the young people. Over 391 young people were interviewed in Kampala, and that was what we call a groundbreaking study.
We conducted the research with her, which was the slum rating scale. With the research we were conducting, we understood how much harm alcohol is to the community.
The government is not interested in giving us these resources or even being a part of it, because I have tried on several occasions to engage them, but they want the figures, but they don't want to be part of the process.
Personally, I like to work with Professor Monica. I'm willing to work with her to see that Uganda is a country free from alcohol.
She has really helped us in undertaking a lot of research and baseline studies, but also as part of her work, we've also been able to use part of her work in as far as our advocacy is concerned at national level, because as a country, we are in the process of developing a national alcohol policy and a law, and those documents really require evidence, they require data. they require evidence for you to be able to argue the case that we need the policy and the law in the country.
But the challenges that I face as a researcher, of course, is connecting with the community and getting resources to do this kind of work. And it's also, of course, working in an environment where time and teamwork is viewed very differently from the world that I come from, where we're very team-oriented and we're very action-oriented. Things move slower here. And the fact that I'm in my small way, am able to have an impact, whether it's in alcohol, drug use, or whether it's enhancing treatment for youth, or whether it's building capacity for some of the organizations that I work with, it's something that I'm filled with gratitude for, to be welcomed and to have these partnerships and making a change that is really improving people's lives. It's a privilege and it's an honor, and it's something that I look forward to every day, despite how hard it may be to work here. And this is something that I really want to do. I think I'm meant to be here to do this.